All right, so we've got Erin, I think, coming on next, and I haven't been given any introductory notes, so I'm counting on everyone to introduce themselves and what they're going to do. So over to you, Erin.
Hi, I'm Erin, and I'm nervous now having to follow Jane because that was really, really good. And I'm mostly going to be reading my stuff, so it's more like story time than entertaining, so I hope I don't bore everybody. But I have many disabilities. I kind of joke that I've got a disability collection at this point. I have EDS and MCS and lymphedema, and you can kind of see my world's saddest wine rack that I've repurposed for my lymphedema hanging rack for my legs over there, because my legs tend to expand throughout the day and then I have to be in it for 2 hours to deflate them. And my daughter calls it the deplumper, so sounds a little bit like Darth Vader on a bad day. So that's where I live in the evenings. But I'm going to be talking to you mostly about environmental sensitivities and multiple chemical sensitivity, because those are the things that mostly impact my access and people that I know who are actually applying for MAID because they do not have resources and live in poverty, more so than just have the disability. Because if you have money to maintain yourself, then everything is a lot easier. So I'm the chair of the Environmental Sensitivities Coalition of Canada. It's a new group. It was created almost 4 days ago now, and it currently has 55 members. So our goal is to review existing accessibility and human rights legislation and update it so that it's relevant and impactful for people with environmental sensitivities of all kinds. We also intend to create missing accessibility legislation, which is pretty extensive. So I have, like I said, multiple chemical sensitivity, and I'm going to go a little bit more about that later, about how that works. But environmental sensitivities include many, many illnesses. Chronic illnesses and diseases like allergies, dermatitis, asthma, mold sensitivity, other respiratory disorders. I have Mycobacterium avium, one of my collection. Autism and ADHD, which I also have. Migraines, mast cell disorders, Parkinson's, multiple sclerosis, and pretty much anything where you're affected negatively by something that's happening around you or something that you can ingest. So while those of us with multiple chemical sensitivity and other more highly reactive disorders have a much harder time, there's a lot of people who have smaller reactions, and we're all on the same team. So recently, 3 of the people who are currently in the Environmental Sensitivities Coalition applied to be on Accessibility Standards Canada working group for workplace standards for COVID. Online, we had flagged them a few times that the standards that they had put out were not adequate. And they had explicitly stated that workplaces should be asking their employees for guidance on what is safe for them, which makes the employees have to disclose their disability to get accommodated. And that's against human rights legislation. So often people who disclose their disability, who have these more reactive issues, they're not accommodated, and instead they're just fired. This has happened to most of the people who I know who have multiple chemical sensitivity. And especially in the midst of a pandemic where everyone is panic spraying alcohol-based products on everything because they are explicitly told to by Health Canada, instead of being told to use accessible products that are peroxide-based or simply unscented soaps, which also kill the virus, it would be really, really hard for an employee to advocate for themselves. So you're not only asking them to go against the major health authority, you're asking them to set their fears aside, which is really not an easy task. And unfortunately, we found that you need to be a part of an advocacy group in order to be invited into any of the working groups. So if you want to affect that legislation. And we had mentioned to them that this was a little bit discriminatory for folks with our medical issues because no group existed to advocate for people with environmental sensitivities, let alone like the most severe of us. And the standards group then amended their request and said, if you were a disabled person who is applying and you're not a part of or not paid by a group, that you be paid for the participation. So 3 of us applied and were denied. 2 of us never even received a notification of the denial. So what do you do when the group that is supposed to be looking out for you, be the health agency for your country, is actually your biggest access barrier. So you file a whole bunch of human rights complaints, and then you start your own coalition. And that's where we are now. So right now, myself and about the 55 other people are going over existing legislation. We're creating amendments and logging all of the missing accommodations throughout the disabilities. So we're getting a group consensus on our accessibility needs so that we can have ambassadors from the coalition sit on advisory boards throughout the country and advocate for us so that we too can access spaces safely. Now, in regards to Bill C7, one of the members in the group, she's actually applied for MAID, and her application is coming up in about 10 days now. So it's very personal. Several other group members are living in complete poverty. They're on disability support programs, which the provincial ones are really underfunded. And they're unable to access the most basic healthcare, food, safe air, water, or service people to even come into their low income housing. They're told that it's up to them to find safe utility workers because the people who are running the housing, they just don't know how to accommodate them. And the utility services are not providing staff who are adequately unscented and chemical free to enter their apartments safely. So as many businesses right now are dousing all their delivery packages in alcohol-based products, again, because Health Canada told them to, even the food is contaminated with disinfectants. So like a while back at the beginning of the pandemic, I got some raspberries from Zare's curbside pickup. And even after washing them, they made both my daughter and I sick just from putting one in our mouths. My daughter also has the multiple chemical sensitivity and she gets nosebleeds amongst other things. And we had to throw them out in the compost. And that's a luxury to be able to do. I am one of the most privileged people I know with my disease. And my experience, while very limited in healthcare and other accesses, is not even nearly comparable to what someone who is living on disability support has to go through. The idea that a person who is not even provided a safe living space, food, or access to a hospital has more ready availability to medically assisted suicide than they do to the supports that could help them be well and get healthy is just staggering to me. It's like tantamount to social murder. So it's not mercy, it's not control over your death. It's being pushed towards suicide because your life is not livable and the human rights that are supposed to guarantee you your access are doing nothing to help you. So if anybody else out there has an environmental sensitivity of all kind, you're interested in being counted or being heard or participating in creating the standards that will represent the human rights of people, then I invite you to come visit me on Twitter. I'm at Erin. I'm not shy. You can talk to me about anything. I will chat you back, follow you, we can message and everything. And I'll give you all the information on how to join the group and you can become a part of the consensus there. So next I'm gonna just tell you a little bit about multiple chemical sensitivity. And I wrote this on International Disabled People's Day because the focus was on invisible disabilities. And this is like, I have all of them. So we got a big group. Environmental illnesses, they're a group of disorders and they're covered under human rights in Canada and in Ontario as a part of the AODA, where I live. But they're hardly ever included in the accessibility plans, like I mentioned. So people who have MCS can react to a large variety of things, and it's often along the volatile organic compounds groups. So these can be naturally occurring, like in essential oils, tree saps, and pollens, or they can be chemically processed. Usually there are natural-based ingredients in the processed product that's a root of the issue, but they're ubiquitous, and current labeling laws don't protect people with reactions outside of the most common allergies. So the most common sensitivity for people with what I call beginner's MCS is perfume and scented products. Features of MCS include migraines, hives, eczema, food sensitivity similar to mast cell activation syndrome, brain fog, dizziness, asthma, hair loss, psoriasis, nervous system control issues, muscle control issues, vomiting, diarrhea, breathing issues, emotional regulation issues, body temperature regulation issues, sweating, nosebleeds. I'm sure there's other things I've forgotten. The day that I wrote this, I had ran the dishwasher and they have rubber gaskets. And so when you do that, then they off gas, and I was writing at the time. So I'm sure, I don't know if I missed everything. I have lung lesions and they're caused by the chemicals, but I had to ask multiple doctors before one even gave me a CT scan to prove that I even had them, because the knowledge management throughout the medical community for this is so lacking. So there's only a few treatment centers in Canada for environmental illnesses, and there's no environmentally safe hotels or places to stay if you can get an appointment at one, because hotels are not forced to be accessible. Most even spray signature scents around their properties. It was over a 1.5 year wait to get into the Women's College Hospital in Toronto because it's not properly funded. There are no official treatments. They try to get you seen by as many specialists as they can for the associated symptoms, but often people with MCS don't have traditional test results, and then you're left to deal with your disease alone. Or you're forced to try out alternative medicines, which are not covered under provincial healthcare or insurance or disability support programs, even if you have access to insurance. Because in Canada, we do not make it so that if you get private insurance, they can ask you for your priors, and I've been denied from having cancer prior. So this leaves the MCS community vulnerable to scammy practitioners and commercialized healthcare fraud, which often makes their issues worse. And the alternative practices that do help, they're not sanctioned, and there's been no funding put into the research or attempts at creating the medicines. Promising medicines like low-dose naltrexone are not usually prescribed for the symptoms related to them, and you have to fight to even get a doctor who is familiar with the illness who will try to treat you. And just as an aside, since I wrote this, I have since got LDN as my prescription, and it totally works. So bug your doctors, try to get them to do that for you if you've got MCS. And as I said, the knowledge management on its illness is so bad amongst the healthcare practitioners that people are often prescribed antidepressants and then gaslit about their symptoms. After having anaphylaxis while traveling internationally, a doctor in Toronto Emergency General told me there was no such thing as MCS and that I was having a panic attack. So I went home and I vomited foam on my own. I got no blood tests to capture the moment. And people who have EMF sensitivity are the hardest hit with this issue out of the environmental illnesses. So the only option really right now, and for most people, is avoidance. And for a lot of folks, that means complete isolation. And some of the people now, just having gone through the COVID isolation, just lose their minds when they don't have access to anything. So could you imagine it being always? You don't have safe access to healthcare, hospitals, doctors' offices, physical therapists, and even dentists and dermatologists often sell scented products, and they use essential oil diffusers in their offices, making them amongst the worst of the healthcare providers for accessibility. So even now, with the inaccessible cleaning products being broadcast as the only safe option by Health Canada, we've been completely cast aside, it feels like. And Health Canada even on their website warns about the dangers of indoor VOCs, and then they've created this situation where they're unavoidable. My daughter has no access to her school. So she's been remote schooling the whole time, and I am high risk, so she'd probably be home anyway, but we don't have the option. And it's gonna take a long time for these things to clear. And I've mentioned this to the board of trustees for her school 3 times, and I'm still waiting on replies to how they're gonna fix it. And the people with MCS who have to do treatments to get these pervasive products out of like drywall and other things like that, there's off-gassing protocols we use, and they have limitations. So the pharmacies, so if you want to go get a prescription, they sell perfumes. And they're often the only places you can go to get flu shots. Canada Post locations are often located inside dry cleaners or perfume stores. And pharmacies don't even offer accessible curbside services depending on where you live, even during COVID. We do not have regulations on home dryer venting filtration to stop the onslaught of dryer sheet perfumes that affect people and the environment. Airlines spray pesticides on airplanes, and they're not required to notify passengers. Many cleaning standards mandated by the government for food services are inaccessible, and that bars disabled people from working in entire industries. So once you're pushed out of the workforce by the inaccessible standards and unenforced standards, you have the option of just not having your disability covered under Canada's disability tax credit program. And then you have to fight to be on provincial disability, and it's below poverty rates. Even the assistive device program in Ontario doesn't cover air purifiers needed to maintain our health. I actually had to turn mine off. I've got like one per room, so it sounds like being in a wind tunnel in my house at all times. So I didn't want to distract everything from that. That's why my voice is a little scratchy right now. So also they're not tax deductible, and neither is infrared sauna use. And those are the only suggested treatments right now. There's no safe homeless shelters, and most low-income housing is not chemically accessible. There's no scent-free, low VOC long-term care centers. Food banks are not accessible. They can't handle requests such as no nightshades, pesticides, or foods without preservatives. We don't have VOC ratings on products. We don't have a scent-free path similar to gluten-free paths for foods, and there's often contamination. So I need a back brace because of my EDS and scoliosis and degenerative disc disease, but I can't get one because I can't find one that I don't react to. So we're recognized in Canada, but we're not supported or treated. And we need that to stop because they can't offer people suicide when they don't offer them life. So funding research into treatments and capturing genetic information for those afflicted to add to drug reaction databases needs to happen. Clearly stating accessible standards and not forcing disabled people to disclose their illnesses to get accommodations needs to happen. Updating inaccessible workplace standards, like for commercial kitchens. Creating a VOC rating standard for products as a part of the environmental carbon emissions legislation. Creating a scent-free food chain, creating accessible housing, funding disabled people who can't work, and providing them with the tools they need to get well, like knowledgeable doctors, air purifiers, and grocery cards to purchase their own foods. And hiring people with MCS to create your policies and solutions. So something that anyone out there could do personally for us is stop using dryer sheets, because not only does it emit from you, it emits into the air, and it's unsafe to walk down the sidewalk. And if you enjoy perfume, please enjoy it in your home so that other people can enjoy leaving theirs. And I'll cut out the other one thing I was going to do so I can get you back your times here. But I just have an op-ed that I wanted to read. So should they publish this? Here's your preview. Kindness is good for your taxes. Helping people can help you. So we have a universal basic income is a federally accepted way to help people who the provinces are failing and save money. Currently, we fund food banks that don't cover medical diets and they limit visits. People then need to go to the hospital to get vitamin infusions, which are covered and more expensive. They still get sick without food and need hospitals again. People like me who can get well enough to work if properly fed by means like the autoimmune protocol diet, they stay sick and they need permanent support. Half is paid in administration costs for food banks and in support workers managing small money payout requests. Most people can't afford rent at an individual cap of $1,169 per person on ODSP. Ontario Works is even less. And if you think this seems inefficient and cruel, you're right. And Lord help you if you need physical therapy after an accident because it's not covered, nor are many of the medical devices. If you have lymphedema post-cancer, the assistive device program pays for 75% of a maximum of 3 sets of 2 outfits, each in a 12-month period. 2 outfits provided, 1 for wash, 1 for wear. So if you need full-length stockings like I do, but you're on ODSP, that essentially means you have 2 pair of underwear for the year, which is not very fancy. So without them, my legs expand so much I can't walk. And even 25% of $140 stockings is an impressive cost to someone on disability support. Most chronic illnesses medicines are not covered under the Trillium program here. Accessible low-income housing has a 10-year waiting period, and units for people with environmental sensitivity do not exist. Ford currently is forcing everyone on social assistance to reapply right now, and is mandating disability and social supports a municipal concern. That causes your property taxes to go up and rent to go up because landlords are allowed to increase by too much each year. Even during a pandemic, there are no provincial bans on evictions. People become homeless, placing even more funding needs on municipalities. Shifting costs to UBI increased people's mental health and physical health in all trials and studies, because relying on begging and charity is depressing, to say the least, and is the best chance for them to get well and potentially be employable. So in high school, just a moment, I had to move out on my own. And, oh, just a moment. You're gonna come in for a sec? So this is what remote school is like when you're trying to get stuff done at the end of the day. This is my daughter, Agent. All right, I'm doing my thing. Can you scooch out for a second?
Okay, that's lunch.
I know it's lunch. I'll be with you just fine. Close my door, please. Thank you. So, sorry. In high school, I had to move out on my own and I was on welfare. And I went to school and I had 2 jobs at the same time. And I would have been out of support programs much faster and might have been able to afford to finish university at that time, but OSAP was cut by the Harris government. I left university, I had a minimum wage job at all times, but I did not qualify for support and regularly had to collect bottles to make up incoming GOT food, most of which was moldy or I couldn't eat from the food bank. So I know this personally. I scraped by for years and eventually worked my way up to attending university through night schools and weekends. I paid off my loans and I embarked on my careers. However, some people can't work due to disabilities. And I was in this boat recently when I lived in Toronto next to a factory operating illegally in the basement of a building next door, blowing toxic fumes into my yard. It took 2 years fighting the various government agencies to have it shut down. And I had enough savings to wade through that, but 2 years of Toronto mortgage and healthcare costs is too much for most people. Like people like pretty much everybody would have gotten sick and needed support. And my taxable medical costs the first year that I was sick were more than the yearly income for a person on ODSP. It did not include osteopathy, air purifiers, and supplements, which are incredibly necessary for someone with my disabilities, but they're somehow not deductible. And it's cruel to not provide a path for health and yet berate a person for being unable to work and instead give them a path to death. So everyone deserves to live above poverty no matter what. No one else should have to struggle like I did. Money for the program should be coming from closing tax loopholes on the extremely rich and corporations like Amazon, who pays nothing compared to the average person. The hype about scammers on systems should be directed at these businesses who put their employees in the position where they get sick and they can't recover. These are real people who need our help. And I, for one, am happy to endorse a system to help them. So everyone is one bad day away from a disability, and someday it might be you. And we should be helping people. And that's what I got.
Erin, thank you so much. And it was great to see your daughter. Don't apologize. It's wonderful. We are real people with real lives, worth hanging on to.
Yes, absolutely.
Yeah, so this is why we think people really misunderstand that with regard to Bill C7. So thank you so much. feel free to come back and watch through the YouTube channel later, or to, join us again. So
Thanks. My daughter told her class today, she said, my mom's going to be on YouTube to tell the government not to suicide poor people.
right, she's right. I
All the grade 4 class now knows.
Yeah, I love this phrase you used around social murder, that's very powerful. So thank you.
Have a great day.
And Catherine's thanking you as well. Her mic wasn't on, but I could read her lip.